I'm Annie Rowe. I'm an associate professor in the Department of Health, Society, and Behavior here at Wen Public Health. Before the 2022 Medicaid expansion, undocumented immigrants often faced a lot of barriers getting their prescription drugs. They often had to use discount programs through community clinics or paid out of pocket. And especially for certain conditions like type 2 diabetes, some of the newest therapeutics were out of reach. Medi-Cal expansion changed the kinds of drugs that type 2 diabetes patients could access. In particular, some of the newest type 2 diabetes therapeutics like the SGLT2s and the GLP-1s. These are highly effective, but used to be out of reach for undocumented immigrants. And with this coverage, doctors were now able to prescribe some of their most sickest patients these new drugs without going through long administrative processes. To understand how access changed, my pilot project examined type 2 diabetes prescriptions before and after the May 2022 Medi-Cal expansion for older undocumented immigrants. And we found that within 1 year after the policy was enacted, patients with type 2 diabetes at a community clinic their percentages of being prescribed these medications rose from 8% to 33%. And by the end of the study period, their prescription rates were comparable to documented patients. Access to these newer diabetes therapeutics matters because they do more than control blood sugar. They can help with weight loss and protect the heart and kidneys, which can prevent serious complications. Our study shows that expanding access to healthcare can reduce disparities in type 2 diabetes treatment. Latino communities have among the highest rates of diabetes, and better access to effective medications can reduce blood sugar, reduce BMI, and ultimately reduce long-term strain on the healthcare system. So this is a highly contentious policy. Even the current administration is very critical of it. But the big takeaway is that these drugs work and that they're life-changing. There might be some short-term costs because these drugs are very expensive, but there could be long-term benefit as patients avoid the ED. They're not going to be hospitalized and they're avoiding costly procedures because of complications.